More than 182,000 prisoners in the U.S. have tested positive for coronavirus since the pandemic began. That's according to the Marshall Project, which has been tracking coronavirus cases and deaths in the prison system. Its members say as of November 10th, new infections have risen to their highest levels since the start of the pandemic. The country has also seen over 1,400 prisoners die as a result of COVID-related causes. Cases of the virus originally spiked in those environments because social distancing is difficult. The cases even led to some states releasing prisoners. Yesterday, I spoke with a senior editor for the Marshall Project about its findings. Tom Meagher is a senior editor for the Marshall Project, and he joins me now. Hi, Tom. Welcome. Great to have you with us. So we talked about a lack of social distancing there, but is that really the only reason we're seeing prisons hit so hard by the coronavirus? What are some of the other factors contributing?
It's certainly one part of it. It is very difficult for people in prison to maintain any kind of space, but it's not the only one. There's also a lack of access to some of the basic tools of hygiene that we have on the outside. Getting hand sanitizer, for instance, getting soap is not always available for people inside. We're also seeing that in some states that they're not testing as vigorously as they might. So it can be difficult to track an outbreak until it's really all around you.
And what states or areas have you found that prisons are being impacted the most?
We're really seeing it across the country. I mean, some states that have relatively small systems that were not acquiring a lot of cases over the summer seem to be ticking up now. In the past couple of weeks, we've seen pretty significant outbreaks in Texas, Wisconsin, even South Dakota had a large outbreak. Minnesota is another one that has been affected recently. We talked with a corrections official in Minnesota who said they had one facility where there were no cases at all for 5 months. And then all of a sudden, within 2 weeks, they had 900 positive cases in their prison. So this does seem to be happening across the country, as it is happening to the outside as well.
Right. And of course, not surprisingly, it's not just the incarcerated population that's affected. Your research finds nearly 42,000 cases of coronavirus and at least 93 deaths have been reported among prison staff. What more do we know about those cases?
They're much harder to track, to be honest. The prison systems are not quite as forthcoming on how many people are being tested. And much of what we do know about prison employees getting sick is them self-reporting to their employers. But obviously there are tens of thousands of cases. It's a very difficult situation. In some cases where prisons have been locked down since March, not allowing visitors in, the only people coming in and out of prisons that might be carriers for coronavirus are the workers there. On the other hand, we've heard reports from states where the workers are not receiving the kind of protective equipment, masks and gloves and the like, that they would expect on the job. So it can be sort of a hazardous work situation as well.
So do you believe that these cases then are just being underreported across the prison system?
That's a great question. We ask ourselves that every week as we try to collect our data with our partners at the Associated Press. It's hard to say. In some cases, there are states that have tested every single prisoner and every single employee, but they're very, very few. In the early months of the pandemic, what we saw in March, April, May in particular, was that states were really only testing people who were presenting symptoms. And then, you would have a state like Ohio where all of a sudden they did test everyone in a facility and found that 85% of the people that were infected had no symptoms whatsoever. So that's really a question for us in many states, that if they don't have a vigorous universal testing system, how many people are carrying the virus, potentially spreading it without displaying any symptoms at all.
And so what would you recommend, or what does the medical community recommend needs to be done in prisons to control these outbreaks and prevent the spread? And are you seeing some state systems, implement these measures effectively?
Sure. A lot of what the medical experts recommend is the same thing we're hearing on the outside, that if you are potentially infected, you should be isolated or quarantined. People, if they can't physically keep 6 feet of distance, they should be wearing masks, have other protective gear. In many prison systems, none of this is really feasible and hasn't been fully implemented. Another possible solution that many advocates have been pushing for back since the spring is to release people who are close to the end of their terms, people who might be vulnerable, people with nonviolent charges, people who are about to finish their prison term in the next few months anyway, to try to get fewer people behind bars to just allow for any more space that can be made. And as you alluded to at the beginning, there's a couple of states that have done that. California and New Jersey have announced releases of thousands of prisoners. But there's still many people behind bars that are struggling to have the equipment to keep themselves safe and to keep distance from one another as the virus continues to spread.
And so are any of those prison systems successfully stemming the spread?
That's a good question. It's hard to tell. It's a little bit early. New Jersey, for instance, just had some releases about a week and a half ago, right after Election Day. California has been releasing folks throughout the pandemic, but continue to have outbreaks here and there. We've also seen in many states the prison population has been dropping because the courts are closed. Fewer people have been sentenced. Fewer people are being sanctioned for parole violations. So prison populations have been dropping in many states, but yet we continue to see outbreaks across the country.
All right, well, Tom Meagher of the Marshall Project, thank you so much for sharing your research with us. We appreciate it.
Yes, thank you for having me.